I'm assessing my patient who is at risk for aspiration. When I come in the room, I'm going to do hand hygiene, and I'm going to put on regular gloves. There's a couple of interventions I'm going to do to help prevent this patient from aspirating on any food or fluids or emesis. So one of those first things I can do, of course, explain things to the patient. I'm going to raise their head to the bed to a minimum of 30 degrees, also known as a semi-Fowler's position. If this patient is going to eat, which I do have some fluids here, then I'm going to stay in here and monitor the patient while they're eating. And if they're eating, they're going to sit up in a high Fowler's position at 90 degrees. This will help decrease their risk of aspirating. So the patient is sitting up, and I would help them make sure that they are eating and swallowing okay. If there was any risk of possibly pocketing food on one side or another, I can take my little pen light, have them open their mouth and check and see. So that's one intervention I can do. Another intervention is I'm going to have suction set up in the room. So there's when I have my suction container, this is considered output, so it is measured. It can go from as small as 50 mLs up to 1200 mLs of output. I have a couple of little holes up here. One says vacuum, one says patient, another one says ortho. We're going to keep the ortho covered, and we're going to slide this right into the holder. I have two pieces of tubing. One of them is a short piece of tubing. The short piece of tubing is going to go from the vacuum, and my vacuum is set against the wall on a white plate. Oxygen is on a green plate. Medical air is on a yellow plate. Tubing is going to go from the vacuum on the wall to the vacuum on the canister. The longer tubing that's going to go to the patient goes right in where it says patient, and then I can give this. We can hook what's called a yonker or a oral suction here, and the patient can self-suction secretions. The nurse can help suction secretions out of the patient, or if they started to vomit, we've got them sitting up and we can, help suction out secretions. And we can leave that there for the patient to use. We want to make sure that we turn it on. There's regular and full. You can also dial how much you want the patient and switch the vacuum to on so that the suction is available for the patient.
Will you do that one more time about the on and stuff?
Oh yeah. So I've got everything set up and ready, but I do need to turn it on up here at the top at the regulator. So it has regular and full. You can dial it to whatever you need for the patient. A lot of times if it's just oral suction, we'll have it on full. And then there's a little switch here on the wall that turns the vacuum on so that the patient actually has suction available. When I'm done, I'm going to take my regular gloves off, put those in the trash, and use hand hygiene when I leave the room.